Warning along the shoreline after a spike in fentanyl overdoses. Channel 3 New Haven Bureau Chief Matt McFarland is live in East Haven, and police say they want people who live there to keep themselves and loved ones safe by getting educated on these dangers. Matt.
Yeah, absolutely, Aaron. Education. They say it's maybe knowing what the signs of an overdose are, having access to Narcan and being able to administer it. And, you know, they're not alone. Healthcare providers, outreach workers in neighboring New Haven, they're doing the exact same thing and then some to keep people safe and alive.
This is a global epidemic.
As the clinical director of the community healthcare van, Terry Bohannon and his staff are on the front lines when it comes to treating those battling opioid addiction.
We do harm reduction, we do needle exchange, and we give out fentanyl strips so people can test the product they have to see how much fentanyl is in it.
And right now, that's their biggest concern.
Fentanyl changes this whole equation. Where 5 years ago there wasn't so much fentanyl around. They're going to use what they think is their required amount to sustain their habit, and it could be 20 times as much. Highly dangerous.
It's to the point that this week, neighboring East Haven's police department put out a warning following an uptick in fentanyl overdoses, asking residents to educate themselves about the dangers. Let us be clear, the East Haven Police Department cares about its citizens and is more concerned about saving lives and connecting those with addiction issues to care and treatment than it cares about making arrests. That includes encouraging people to not use opioids alone, having access to Narcan, and highlighting Connecticut's Good Samaritan law, which means you won't get in trouble if you call 911 and there's drug paraphernalia at the scene. Far too many times we're seeing valuable minutes lost because people witnessing an overdose panic and clean up prior to calling 911. Police stress their focus is on finding those responsible for providing the deadly fentanyl. And as for the crew here with the community healthcare van, their message is clear.
It needs to be really understood that this is an illness. We didn't look at substance abuse before like this. We don't penalize people who have heart conditions or diabetes medicine. We treat them. We get them into treatment. People who have substance abuse have an illness. They need to be treated and they need to be respected, but most of all, they need to be protected.
For more information on Connecticut's Good Samaritan law, along with the community health care van, we've got links on the Channel 3 app. We're live at the mobile newsroom in East Haven. Matt McFarland, Channel 3 Eyewitness News.